everybody. Welcome to the July COVID Vaccine Equity Task Force meeting. So the usual announcements when we start. So the task force operates in compliance with the Kansas Open Meetings Act. The meeting is being recorded and live streamed on KDHE's YouTube channel. Please mute yourselves when not speaking to prevent audio interference. So nice to see everybody, and welcome to anybody who's here for the first time. And of course, welcome to everybody who has attended before. My name's Jimena Garcia, and I am the governor's senior advisor for vaccine equity. I'm going to be leading this discussion today together with Dr. Kali Akers and my colleagues from KDHE. And I'm going to just start with a quick review of the agenda. Here we go. Okay, so we're going to start with quick introductions. And then after that, we're going to have Jamie Gable review the most current COVID vaccine data. After that, I'm going to share information about the Bridge Access Program, which is meant to help uninsured Kansans get free COVID vaccines starting this fall. The focus in general of the meeting is going to continue with the theme we started last month, which is Latino vaccination and health access in Kansas. We have two guest speakers, Carla Rivas D'Amico and Larissa Carrillo Martinez, and they're going to share their work with us. And then we're going to wrap up with a meet and greet session with Carla, and then announcements. So let's jump in. If you're attending this meeting for the first time, and I do see some new faces, and you feel like it would be awesome if you just tell us your name and like a couple of things about a little bit of what you're passionate about. And if you're here, if you've been here before, just go ahead and put your name and organization into the chat. So I'll open the floor now to anybody new who would like to introduce themselves. Okay, well, let's jump in. So I'm going to pass the floor now to Jamie Gable, who's going to go over the most recent COVID vaccine data with us.
All right. 1 second, trying to get my notes to.
That's always the tricky part.
All right. Thank you so much, Dr. Garcia, for having me as always. So after speaking with Dr. Garcia, we've decided to shorten our slides a little bit this time. We're going to have our normal overview slide that you're seeing right now, and then we'll be looking at the bivalent doses by race and ethnicity. So the reason that we've done away with a couple of our other slides is because we think it's really important to keep our focus on current immunity in Kansas, which would be the bivalent doses. Somebody who had maybe received a first dose of the series back in maybe May of 2021, that no longer really holds a ton of meaning. So we really wanted to focus on what is current. If you are interested in those numbers, the KDHE COVID-19 vaccine dashboard does still maintain that number. So you can go through and look at it, and it does have it in the demographics tab for different races and ethnicities. So our first slide is the overview of vaccine uptake in Kansas as of July 5th for 1 dose, completed COVID-19 series, and bivalent booster doses. We continue to see just extremely small increases for 1 dose and completed series. We do see a little bit bigger increases for adult bivalent doses. Older adults continue to have the highest coverage for bivalent and for all other doses, and tender age has very low coverage for bivalent at less than 2%. Next slide, please. So this slide, we have bivalent booster uptake for different races and age groups. The native data here is updated to reflect anyone who has indicated native as one of their races in WebIZ, and they have the highest coverage for all age groups. White has the second highest coverage for adults and older adults, and Asian has the second highest coverage for children. I wanted to do just a quick little refresher on what any race AIAN means. This would indicate that native was indicated as a race, but other races may have also been indicated in WebIC. So essentially it will add those who are multiracial that have Native as one of their races to those who have Native as their only race to provide a better metric of coverage for Natives. I also wanted to remind everyone that when we are looking at races, it is independent of ethnicity. So if somebody were to mark that they were Hispanic or Latino, and they were also any of the races you see here, they will be seen in this data, and they will also be seen on the next slide in the Latino and Hispanic data. Next slide, please. So this slide is going to be similar information, but now we're looking at ethnicity instead of race. So we know from previous meetings that we tend to see higher coverage in Hispanic and Latino for having received at least one dose of COVID-19 vaccine, but we're seeing for the bivalent booster that non-Hispanic and Latino for all age groups have higher coverage. I know that Dr. Garcia has mentioned that Latino health equity is going to be a focus today. So we have some data to consider when going about those discussions. Those are my slides for today. If you want any other information or have any questions, please do reach out.
Thank you, Jamie. So before we go to our guest speakers, I just wanted to talk for a couple minutes about the information that I know about it's called the COVID-19 Vaccine Bridge Program, and a little bit just about commercialization of COVID vaccine and how that's going to impact access and so forth. So thank you. These are my slides. So although the federal program for distribution of COVID-19 vaccines is ending, commercialization is not going to affect the availability of vaccines. So the vaccines are going to be available and are covered at no cost within most private health insurance, Medicare, and Medicaid. Also for our kids, luckily kids ages 6 months to 18 years, COVID-19 vaccine is going to be available at no cost through the VFC program for kids that don't have insurance. And so it kind of leaves the category of adults without insurance in terms of how can they access COVID-19 without any cost. And that's what the COVID-19 Bridge program is. If you go to the next slide. So essentially adults without insurance, Medicaid, or Medicare who can't afford to pay for vaccines starting this fall through December 2024, there's going to be vaccine accessible at no cost through this HHS COVID-19 Bridge program. And it's going to function through two different types of networks. So one network is going to be the existing public health infrastructure, specifically the state immunization awardees, local health departments, and then HRSA supported health centers. The other part of the program is intended to be implemented through retail pharmacies. So the CDC has expressed its intent to work through modifications to existing contracts with 3 pharmacies, which are CVS, Walgreens, and eTrue North, which is a network of many community level independent pharmacies. The expectation is that the pharmacy program is going to be up and ready to launch in October. And as I have more details about how it's going to work in our state, I will keep you in the loop. So with that, I am excited to introduce our first guest speaker. It's Carla Rivera D'Amico, and she's the executive director of KLAC. And I'm going to, Carla, let you introduce yourself in any way that you want. And we have about 15 minutes for this discussion.
Hello, everyone. Sorry, I'm having issues with my devices today. So I am on my phone. But thank you so much for having me on. At this time, I'm going to turn it over to Monica Vargas Huertas, who is here with us to give some information about House Bill 2350, which is a new piece of legislation that just went into effect on July 1st that we worked on and have been working on. We've been traveling across the state, giving information to communities about this bill. And depending on where you work, you may have heard some stir about it, some concern from community members. So we wanted to be able to share some of the information that we've been sharing with them regarding this legislation. So I'm going to turn it over to Monica, and thank you all for your patience.
Thanks. Hey, Carla and Monica, I'm so sorry. If I can just slightly redirect us. Carla and I were messaging on the back end. And I understand, I think we're trying to utilize this 15 minutes and the 15 minutes at the end so that we have the full 30 minutes for the presentation. So I would say to the leadership team, if it's okay with you, maybe we could switch to Clarissa, let her do her quick, and then that full last 30 minutes, we can go into the breakout session to continue this conversation, if that's okay.
That sounds great. So let me adjust the pins really quickly. Thanks everybody for being patient as we jostle a little bit of the agenda. I'm excited to introduce my colleague on the COPE project to tell you a little bit about her work. Clarissa Carrillo Martinez is the regional community lead for the Southwest region of Kansas within the Communities Organizing to Promote Equity project that's hosted by KU Med Center and is funded in part by KDHE. Clarissa is a colleague on that project, and I'll just say I've had a great opportunity to observe her work in communities and really in action and the effort that she contributes to elevating equity, particularly among Latinos. Clarissa is located in Southwest Kansas, and her background includes education through Emporia State and as a fellow first-gen student. Just want to celebrate and acknowledge that. She's just a few hours away from an MBA in marketing and does significant service work around ESL and other top advocacy topics to, again, elevate equity among Latinos in Kansas. So with that, a very brief introduction and entirely inadequate, I'm sure, I'm glad to hand it over to Clarissa.
Well, thank you, Dr. Akers. And again, thank you so much for having me today. I will try to make the best use of the time because there's so much information that I want to share with you as just an exciting information and just the things that I have been able to personally learn from this journey with COPE. But let me go ahead and share my screen. And also just really quick from just showing your hand, how many of you have been out into Southwest Kansas before? Maybe Ford, Finney. All right, so a few of you know our communities well up in this area. So let me see if I can go ahead and share first. All righty. All right. So like Dr. Aker mentioned, I am just sharing a little bit about myself just to kind of give you or paint a little bit of a better picture of how Southwest Kansas looks like and maybe feels like, but also just share why I'm also very passionate and grateful and fortunate to be part of this project, just because it's bringing some great opportunities for our community. Like they mentioned, I am a first-generation college student. My family and I immigrated when I was 10 years old, no English, so we had to face the language barrier. Being a first-generation college student was also difficult. In the summer, I would come back and work at the meat packing plant here at National Beef here in Liberal. That is actually one of the big employers for our community here in Liberal as well. So with that, my love for Southwest Kansas grew, and that's why I call this home for me. So with this project, that is COPE, which is Communities Organizing to Promote Equity, I had the chance to travel around Southwest Kansas and work with our different teams. In this project, again, one of the main missions is to strengthen the community partnerships that already exist within the community to improve the health equity. And as we know, this project came after COVID-19. So one of our missions was also to be able to support communities with COVID testing and vaccination. But as we also progress, one of our missions was also to be able to strengthen those communities to talk about and address some of the social determinants of health, which was one of the big things that a lot of our counties were focusing on, because the social determinants of health can be from education to transportation to food insecurity. So it's been a great opportunity for our counties to be able to address some of those barriers. When it comes to COPE, we have three important components, which one of them is our different partners that can be from our local health departments to the different faith-based organizations like local churches, for schools, so different organizations that we have within our different counties. But we also have our community members, which I also like to call community members with not necessarily a title attached to their name. One of the big things that I am grateful and love about this project is seeing how it gives us the opportunity to also bring people to the table, to invite people to the table that don't necessarily work with an organization. These are community members that are here to share some of their lived experiences and just kind of also give some of the feedback on how we can address some of the barriers. And then we also have our community health workers that are very fundamental and very important part of our project as well. So bringing all those components together, we have our LHEATs, which is our local health equity action teams. So action teams in the mean that we come to the table, we have discussions about the barriers that we are seeing within our communities, but then we also have the opportunity to think about what are some of the strategies that we can potentially implement, or what are some of the things that we can do, some action steps that we can bring into the community to address some of those barriers. Like I mentioned earlier, our CHWs are very important because they are very important for us to be able to build some of the trust in our community. They're also out there helping us promote health equity, but they're also assisting community members with different needs. And at this point in the project, we already heard different stories from clients on how our CHWs have been able to improve their lives, with just helping them sometimes when it comes to finding a doctor in the community, or helping them actually find the insurance that works for them, to also helping them find the resources when it comes to food pantries. So our CHWs have been just amazing, and seeing the work that they have done has just been amazing. And our communities are very grateful for all the work that they have done. Another wonderful thing, and I think I'm just going to continue to use the word wonderful, and trust me, it's not because I am part of this project, but the nice thing about this project as well is that we were able to have a budget for each LHEAT that they can utilize to be able to implement some of the strategies or some of the plans that they want to take action. One of the challenges thing that we had, of course, with having a budget, we also have some of the guidelines that we have to follow, but this has also helped and push our groups to think more creatively, and also think about not just downstream strategies, but more of upstream as well. Because sometimes it's very tempting to say, okay, let's fix this immediate problem and let's just put a Band-Aid over it. Kind of seems like a Band-Aid over it. But then it's like, okay, let's think more deep on how we can not just fix the immediate need, but what else can we do to go more upstream and actually try to tackle some of the roots that is causing some of those problems. So again, it's really nice to have some budget to be able to implement some strategies and help the groups take some action. So some of the topics, and this is not just topics that are happening here in Southwest Kansas, but across Kansas, some of the different barriers that our LHEATs have raised have been from transportation to food insecurity, to childcare, to housing. So it's been, again, interesting to also see some of the things that a lot of our counties have in common. But also the different struggles and barriers that they have within their communities. So I am not the expert for the whole state, but I am, like I mentioned earlier, had the opportunity to run around with our different LHEAT teams in Southwest and Northwest, which my counties are Seward, Grant, Ford, Finney, Thomas, and Sherman. And as one of the reasons that, again, I am very passionate and still living out in this area is because We have several of our counties that more than 50% are Hispanic and Latino living in these areas. So for me, again, it's home. And a lot of times when I go out into the communities and work with our different teams, I cannot help but to see myself and see my family reflected in a lot of those community members that we have sitting at the table. When it comes to Seward County, again, this is my home. And Seward County, their ELHI team is actually incredibly big. I think they have more than 20 members, but it's a group that is very diverse. We actually have a bilingual meeting. So sometimes I help as well trying to do the translation between going from Spanish to English, but it's just been amazing to also see those community members coming in together, because a lot of times too, and I can speak for myself personally, that at times as a Latina, English being my second language, at times we don't feel that we are part of the conversation, or we don't feel that we are adequate enough to come to the table and share some of the experiences that we face in the community. So it's been wonderful to see how some of our community members that do not speak English are coming to the meetings now, and they're slowly warming up to bring some of the issues that they're seeing in the community. One of the things that was eye-opening was when we had a discussion about food insecurity, and we were going on and on about the different food pantries that we have in the community, that we're very lucky to have more than one pantry. But then one of the members was like, yes, we give out food boxes, but have you realized that some of those food boxes do not have the items that sometimes because of culture, or sometimes because, you know, if you're a new family coming into the US, you don't even know how to use some of those items. So again, it's just having those learning conversations with our organizations at the table, but also our community members has been a lot of eye-opening. One of the big highlights for Seward County has also been a partnership with our health department, trying to push again and support vaccinations in our community. There was a concern about coming from our school district about children not being up to date on their vaccines before going back to school. So our health department started an initiative to have vaccination clinics on Saturdays, because our health department is only open from Monday through Friday. And as I mentioned earlier, National Beef is one of our big employers here in the community. Also, like our school district, and I think our community college as well. But a lot of times families work during those days. So then it's really hard for them to take them together, their vaccinations. So it was very eye-opening too, to see typically the health department here in Seward, they see around 40 patients throughout the week. On the Saturday vaccination clinics, they were seeing more than 40 families coming in on a Saturday for 2 hours. So just seeing the big, the demand, we're hoping that those numbers will help also kind of for the county to see that there's a need to maybe expand opening the health department maybe on Saturdays. So again, doing some of the work has been very eye-opening for our communities and for our partners to kind of continue to address the different barriers and problems that we have in our community. So there's so much to share, because again, my counties, they've been working and doing so many different things, from addressing transportation to food insecurity, to housing, to childcare. But Grand County, one of the things that they have focused on as well has been transportation, but also the language barrier. And as I mentioned earlier, that language barrier is something that impacts not only just our Grand County, but several of our counties across Kansas. But again, trying to think about how to not just fix going more upstream. One of the things that Grand County ELHI was, they were able to support a partnership with Genesis Family Health and also the school district, where they were able to bring an ESL adult learning class in their community. But the one thing that they were missing was a curriculum. So the ELHI was able to support this class by bringing curriculum for the teacher and for the group. But I think one of the neat things was seeing our CHWs also coming to this class to be able to present to the students about local resources, but also about information about health topics. So the work has been going from, again, transportation to food insecurity, to vaccination clinics, to trying to provide transportation to cancer events, the one that we have here in Feeney. And the group was super excited about being able to find a way to also, again, bring the different partners to be able to provide transportation to this event, where they were able to help about around 20 individuals to be able to go to this cancer event and get the resources that they needed. So the work has just been amazing, the experience as well. And again, like I mentioned earlier, for me, I feel very fortunate to be part of this project, because as I mentioned, being a Latina, being a first generation, not knowing the language, every time that I travel to a lot of those communities, again, I cannot help but to see myself in a lot of those families, but also, again, feeling that I'm helping and making a difference with the rest of our team. And just to finalize, I think the last thing that I'm going to share is Thomas and Sherman. This is actually a new area for me because Southwest Kansas is my home, but I typically have never really drove all the way up to Northwest. But I got to meet a lot of our team members out there. And one of the things that they're seeing out there is an increment of Latinos and Hispanics in those areas. But with that, they're also, again, seeing some of the barriers, again, with the language barrier. So our LHEAD is trying to, again, strategize on how they can help. One of the biggest things was that because of the language barrier, a lot of our community members were traveling out of the county to receive health services because they didn't know about what services they already had. So again, trying to create that awareness and working with our teams has been great. And I think overall, it's just been a neat experience, not just for myself, but I think for the entire group. So I will stop sharing there because I know we are short on time. So I will pass it back to you, Courtney, or back to Dr. Akers.
Thank you so much, Clarissa. That was amazing. I think we have maybe a minute or two in case anybody has any questions for Clarissa.
I have Sherman and Thomas on my list of where I want to go because I haven't been out there yet.
And they're definitely, I think, like I mentioned, I'm like, they were a new community for me when I went in, but I can definitely call Sherman and Thomas home now because I've been traveling out there. And again, the community is just amazing. But it's interesting also to see that the increment of Hispanic and Latinos up in that community. So I think that's why it's been a learning experience for me, and I'm trying to help them as much as I can as well.
That's awesome.
Well, if anybody else has any questions, feel free to chat. Clarissa, send them to Clarissa via chat. I think I'm going to hand it to Dr. Garcia next to introduce Monica Vargas and Carla. So with that, Dr. Garcia.
Thank you, Vicki. So it's my pleasure to introduce Monica Vargas Huertas. She's the chair of KLAC,